education is the bigger topic. And if you see 10 to 11 years age, when hormone starts increasing, body suddenly grows up, but your mind doesn't grow up that fast. Mind takes some time. Simple thing, if you see, teenagers are very clumsy, we say. If you give them work, they are not able to handle things properly ना. एक बार तो ग्लास गिराता ही है बच्चा, फिर हम बोलते हैं अरे इतना भी नहीं करता है, तो इतना बड़ा हो गया, पर वो बड़ा सिर्फ हाइट से हुआ है, ब्रेन अभी उतना नहीं हुआ है। वो 12-13 साल का जो एज ग्रुप है वो सडन ग्रो होता है, हाथ पाँव बड़े बड़े हो जाते हैं, लेकिन ब्रेन नहीं हुआ है। सो ब्रेन टेक्स टाइम एंड दैट नीड्स द एजुकेशन, because now hormonal surge is there. So, and what is hormonal surge? What is happening is your testosterone is increasing. What that testosterone is doing? What testosterone is responsible for? Anyone? It is not only responsible for secondary sexual characteristic, it is responsible for sexual desire. And that is what gives you sexual pleasure. Hmm? So it's very important when hormonal surge is there and when there are lots of myths around, you need to give educate to all the children. Yeah. Next, social media, newspaper, there's a lot of exposure. There are columns in newspaper, na? Sex education columns are there. People ask so many queries there. If you read that, you never know what is the age of that patient, whoever is asking the question. Na? So sex is very natural instinct, very healthy expression, but because it's very hidden, we never talk, we are not comfortable about it. It is hidden, and that's why it increases the curiosity. At particular age, children really wants to see the sexual parts, sexual organs, opposite person, and that's why that porn attracts them. But danger in the porn is what you see in porn is not real, and there is a fear. See, current generation, almost everyone has seen porn at very early age, but they should not feel what they see is right. They should know what is right, because what you see in the porn is very unreal. It's very imaginary. It is more of a fantasy. There are multiple partner shows, various types of sexual relationships are shown, very prolonged act is shown. So I asked that question, that boy who asked about the girth and this thing. So this boy told me, doctor, I want to increase size and girth. I said, how you know it's your size is small and girth is low? So he said, I am CSW and I am soon entering into porn industry. And they told me, your size is small. See, and this was a phone call. I don't know who was the patient. So I told him, okay, but have you gone to any doctors? There is no medicine which will increase the size and which will increase the girth. What you see in porn is abnormal. Whatever is possible from my side, I explained it, but probably that was his profession and he wanted to increase it. But that creates lot of myths and lot of unreal things in your mind. Hmm? So your uneasiness, your uncomfortable feeling blocks the communication, and that blockage of communication creates lot of myths, lot of wrong concepts, and that is why children go to wrong resources. Wrong resources. And slowly, what happens when you do not talk about sex? You develop wrong concept, and that's why that respect about the subject has gone. Since sex education subject is not covered in medical science, it is not covered in psychology. This subject is absolutely ignored and discarded topic. Hmm? But very important to study about it. Hmm? So sudden increase in the height during puberty, high testosterone level, increase in sexual desire, and that is what there is a lot of sexual stimulation, myths, and then your marriage age is also going ahead. Na? Next, so what testosterone does? Emotional upheaval. Na? We say na, teen terrors, adolescent age when teen really goes to a lot of difficulties because they are not able to handle their moods. There is no resource to help them. There is a lot of emotional changes. Lot of sexual attraction, lot of desire, but no communication. Next. So what testosterone really do? We all know, na? In male, it is responsible for primary sexual characteristics, then it is responsible secondary sexual characteristics, responsible for sex drive and aggression. See, in female, morning we saw PCOD case, no? There, we talked about testosterone also. See what happens in female. Females are extremely sensitive to testosterone hormone. Very small quantities is there secreted in the female, but body is extremely sensitive, and that's why in PCOS also, if you see, there is an increase in testosterone hormone, which gives patient a male type of look. Hmm? They lose hair, lot of acne, and that reduces their sex drive also. Hmm? So primarily in normal, when it is secreted in normal quantity, it increases the sex drive, sexual desire, and sexual pleasure. Hmm? Next. That's why in PCOS also, it's very important why people are developing so much PCOS. Why testosterone level is going up in females. Very important topic to study. We'll just take this big case. A girl and mother complained that she watches porn secretly. Very important to ask how you know that. Because even child is inside the room and locks the door, mother gets worried. Especially if it's a boy child. The only worry is porn. Hmm? Luckily, this was female. So she said, child watches porn, and how you know that? She goes below the bed and watches it, and mother checks the history, internet history. In that, she saw there are lot of porn videos. And then she complained there was no interest in studies. She gets angry if you tell her to study. Hmm? Study was always been problem. Before that, also she was not that intelligent. And surprisingly, father who never used to get stimulated when he used to see wife. He always needed porn to get stimulated. In process, this wife also lost interest from the husband, and this man was also very abusive and dominating. So this mother was also not able to cope with the difficulties. But still, she was somehow managing. She was a literate lady, working lady. So somehow she came to me, and but mother was also going through a lot of difficulties. See how porn affects families. Huh? Very important to think about it. How porn affects the couple, how porn affects the family. Hmm? Very important because small things, then it becomes big, you never know. A simple, casual, fun way you go and watch porn, and soon you get addicted too. So there are all types of experiences, and when you get addicted, it means you get stimulated by that, then you ignore the people around you, then you don't need the partner. Hmm? And that is how then couple relationship also gets affected. So that's why it's very important to study this topic and help people. Like if one patient had come to me, one mother, her son was in fifth or sixth standard, and she came as a literally crying. Madam, I saw that my son had watched porn. What should I do? Where will he become addict? See, your excess reaction is also not needed. By 11 to 12 years, 80% of boys have seen porn. 80%. And not all become addict. It's very few, their background. You have to always wait. They come to you as a patient, you have to see the background why patient gets addicted. Hmm? So here, now see this, one is genetic history, second is the parental conflict, third, both the parents are not very good provider in the sense emotional caretaker. Hmm? So they are not able to take that care, and that's why this child is also suffering that she's not getting emotions at appropriate time. Hmm? Next, so I talked with child. was very much aware that mother had came to me and she is talking because she was going through a lot of educational problem also. So she was going to psychologist and also child suspected